This week on Health Across the Islands, Dominican Republic confirms Mpox cases in detention center. Trinidad and Tobago faces growing childhood obesity crisis. OECS and CARPHA strengthen regional public health partnership. Belize joins World Health Organization Global Drug Monitoring Program. PAHO and AIDS Healthcare Foundation expand partnership to improve HIV diagnosis. All this and more when we return on this week's episode of Health Across the Islands. Thank you for making it Health Across the Islands, your Caribbean weekly health news briefing. I'm your host, Natasha Robinson. Health officials in the Dominican Republic have confirmed cases of Mpox at the Nahayo Men's Correctional and Rehabilitation Center in San Cristobal. According to the Ministry of Public Health, the infections were identified through the country's surveillance system, and authorities have immediately activated containment measures. Health teams are conducting contact tracing, isolating affected individuals, and monitoring close contacts to prevent further spread within the facility. Officials say that the risk to the wider public remains low at this time, but the situation highlights the importance of continued disease surveillance, particularly in crowded settings such as prisons where infectious diseases can spread more easily. The ministry is also urging healthcare workers to remain vigilant and encouraging anyone experiencing symptoms such as fever, swollen lymph nodes, or a rash to seek medical attention promptly. Trinidad and Tobago's Minister of Health has warned that childhood obesity is becoming one of the country's most pressing public health concerns. The minister revealed that 1 in every 4 children is now overweight or obese, a trend that experts say could fuel higher rates of diabetes, hypertension, heart disease, and other chronic illnesses in the years ahead. Health officials are calling for healthier school meals, increased physical activity, and stronger partnerships between families, schools, and communities to encourage healthier lifestyles from an early age. The warning comes as many Caribbean countries continue to battle rising rates of non-communicable diseases, making childhood nutrition and physical activity an increasingly urgent regional priority. The Organization of Eastern Caribbean States, or OECS, and the Caribbean Public Health Agency, CARPHA, have signed a new agreement aimed at strengthening public health collaboration across the Eastern Caribbean. The partnership will enhance disease surveillance, emergency preparedness, laboratory support, and technical cooperation among member states. Regional leaders say the agreement builds on lessons learned from recent public health emergencies, including the COVID-19 pandemic, and will help countries respond more effectively to future disease outbreaks and climate-related health threats. Officials say stronger regional cooperation remains essential to protecting the health and well-being of Caribbean populations. Belize has officially achieved full membership in the World Health Organization (WHO) International Drug Monitoring Program. The milestone allows Belize to contribute reports on suspected adverse drug reactions to the World Health Organization's Global Safety Database, helping health authorities identify potential medicine-related risks more quickly. Officials say participation in the program strengthens the country's pharmacovigilance system, improves patient safety, and ensures medicines used in Belize continue to meet international safety standards. The achievement also places Belize among a growing number of countries working together to improve medicine safety through global data sharing and collaboration. The Pan American Health Organization, PAHO, has announced a new partnership with the AIDS Healthcare Foundation aimed at expanding early HIV diagnosis across Latin America and the Caribbean. The collaboration will focus on increasing access to HIV testing, improving early detection, and connecting more people to treatment before the disease progresses. Health experts say diagnosing HIV early allows individuals to begin life-saving treatment sooner, improve long-term health outcomes, and significantly reduce the risk of transmission. The initiative supports regional efforts to end HIV as a public health threat while reducing stigma and improving access to quality healthcare services for vulnerable populations. Those are your Caribbean health news updates for this week. If you found this roundup helpful, don't forget to like, subscribe, and share so you never miss the health stories shaping our Caribbean. I'm Natasha, and this has been Health Across the Islands. Thank you for watching, and I'll see you next week.